Hi, and welcome to a quick self-study tutorial on basic anatomic terminology that you'll be using in your first month or so at a WVSOM in the Osteopathic Principles and Practices course and Clinical Skills. Alright, let's get moving and see what we got. First and pretty basic is basic regions of the body. The head, I think we're all familiar with, front and back. Neck connects the head to the rest of the torso. The back is on the posterior side from the tip of the coccyx all the way up to the start of the thoracic vertebra. And then thorax, anteriorly as well as wrapping around the back a little bit as well, carries the lungs and the heart. The abdominal cavity, mostly digestive organs, and the pelvis is not very obvious from this view. Pelvis is more of an internal structure. Its surface feature is called the perineum, and that includes the external genitalia and the anal region. Now the upper limb is the upper limb, not the arm. Anatomically, the arm is located here, and then this is the forearm, and this is the hand. Likewise, the lower limb encompasses this whole area in pink. This area right here is the thigh, and this area is the leg, and this is the foot. Alright, let's move on from there. When we describe anatomic structures and anatomic relationships, we do it in what's referred to as the anatomical position so that there's no misunderstanding when you're communicating with a colleague, describing the location of a lesion, a laceration, etc. And to make sure that the nomenclature sticks for everybody, we put every theoretical patient or partner in the anatomic position in our brain. And that's going to be facing you with their feet pointing forward and their palms turned towards you, the viewer. So the first relative terms we need to get down are superior and inferior. We stop using up, down, front, and back because those can mean different things depending on how you're positioned. Superior refers to something that is closer to the head than something else. Likewise, inferior is something that is closer to the tips of the toes than something else. So superior and inferior are relative terms. They are superior or inferior to something else. You may have heard cranial and caudal used in the same way. Cranial towards the head, caudal towards the tail, more appropriate in comparative anatomy. But you may see those occasionally, but we prefer superior and inferior when you're describing things on someone's vertical axis. Here, looking on more of a horizontal axis from what we normally refer to as front and back, we have anterior and posterior. Anterior refers to something closer to the very frontmost part of the body, like the nose, or the nipples, or the toes. So anterior is something much closer to this front side of the person, whereas posterior is something that is going to be the opposite, further towards the back in this manner. And if you've been through comparative anatomy, you've heard this probably referred to as dorsal and ventral. Dorsal being synonymous with posterior and ventral with anterior. Gets a little bit dicier here when we talk about medial, lateral, and median. Now, medial and lateral are relative terms. Medial is something that is closer to the midline of the body than something else, whereas something that is lateral is further away from the midline than something else. So lateral would be, for example, the elbow would be lateral to the collarbone, but the tip of the thumb is lateral to the elbow. So again, these are relative terms. One term that is not relative is median. Median refers to something that is strictly on the midline of the body. So the median line goes right through the center of the body, and it's an absolute. We see these terms again when we refer to the limbs. Upper and lower limb, something that's medial is closer to the midline of the body, and something that's lateral is further away. No big deal there. When we use median in reference to the limbs, we're talking about the midline of the limb itself. So median can refer to the midline of the body as well as the midline of each limb. And in the upper limb, we've got a median nerve that runs right down the center of the forearm, bringing a little bit of relevance to that designation. Sticking with the limbs, let's move on to proximal and distal. Proximal refers to something that's closer to the core of the body than something else. So the shoulder and the hip are both proximal to the elbow and the knee, whereas something that is distal is further away from the body's core. So the tips of the fingers and the tips of the toes are distal to the elbow and the knee. Alright, the body also has a right and a left side, and since you're all college graduates and presumably third grade graduates. I'm going to assume that this is not a big deal, and we can take right and left as understood. Next up, we have superficial and deep. Now, superficial strictly refers to something that's more close or closer to the body's surface than something else, whereas deep means something is much closer to the body's core, the center section of the body, than something else. If we were to take a cut through this person's torso, like so, and get a nice little cross-section right there, we can see that some structures in here are located more superficially, such as B and E. So we've got the muscles of the back and we've got the muscles of the abdominal wall. Fairly superficial compared to C, right in front of the vertebral body here. C is a very deep structure, and C is deep to A, B, D, and E, whereas D is deep to B, but superficial to C. I think everybody probably gets the idea at this point, so let's do a quick little quiz to verify that you got the idea. How would you best describe point A? Located right here. Take 10 seconds. Alright, if you said choice 1, you are correct. A is superior to B, because B is closer to the toes, hence inferior to A. Let's try the next one. What point on this body is most posterior? Take 10. Alright, if you said E, you are absolutely correct, because E is closest to the far posterior end of the body, meaning the most close to the back or the area facing this way. Alright, how would you best describe point A? Alright, point A is lateral to B. It's further away from the midline. It is not lateral to C, it is actually medial to C. So right there. Alright. Deceptively simple question. Thumb is lateral to the fifth finger. True or false? That statement is true. Now if you look at your thumb, and please do, you'll notice you can flip your hand around. Little hint of things to come. If you have your palm facing upward, that's referred to as the supinated position with your palm up. And if you flip your palm over so it's facing the ground, that's referred to as pronated. Remember, when we're referring to structures in the body, we want to have strict nomenclature around the anatomic position. So if we look here, in the anatomic position, person facing you, feet ahead, palms towards you, the thumb is indeed lateral to the fifth or pinky finger. So remember, when it's relative and difficult to say, you want to think of the anatomic position whenever you're naming something. And something a little more complex, take 15 seconds. Alright, and the correct answer is the third. B is distal to A. It's further away from the core of the body, but it is not distal to C. It's actually proximal to C. None of these others satisfy both situations. Alright, so here is a quick study guide to cover all of these. Try to make sure that you get a copy of this as well, but superior and inferior, anterior, posterior, median, medial, lateral, proximal, distal, superficial, deep, and remember, cranial and caudal mean the same thing as superior and inferior, dorsal and ventral as posterior and anterior. Be ready to roll with these terms from day one, and you won't be caught off guard. We're going to finish up by not talking about relative terms, but what's called planes of section of the body: the sagittal plane, the coronal plane, and the axial plane. So let's get those last three slides. When we talk about a sagittal or a parasagittal plane, we're talking about a plane that's splitting the body into a right and a left piece. If the cut goes right down the median line, the median plane. It is referred to as a midline, a median, or a sagittal plane. And this is an example of a sagittal plane. It's gone right through the body on a vertical axis. And right here, we can see the vertebral bodies. We can see a bit of the spinal cord right there. It's not important at this point that you identify these anatomic structures, but it is important that you know what a sagittal plane is. If we were to go a little bit to the left or the right of this plane, we would no longer be on the midline. We'd be on a parasagittal plane. You can see we've picked up lungs, ribs, neck muscles, the brain, and one of the eyeballs. So right here, we are no longer on the exact midline. We've moved off to the left or right, but we're still dividing the body into a right and left piece, so this is referred to as a parasagittal cut or plane. And all of these images were generated from this website right here. Feel free to play around with it if you are so inclined. Next up is the coronal plane. The coronal plane splits the body into an anterior and posterior piece. So if we were to view a coronal image, we'd see something like this. This is a view of the thorax and abdomen of a coronal plane. Here's the collarbone on each side, the lungs, there's the right, there's the left, and the heart and great vessels. We go across the diaphragm here and enter the abdominal cavity where we have the liver, the stomach, quite a bit of intraperitoneal fat, as well as the small and large intestine. This is a coronal image. We can do the same thing with any part of the body. Here's the head, the brain, the extraocular muscles around the eye, and the tongue. So just remember, when you see a division of this nature, it's coronal. And last, and definitely not least, is the transverse, axial, or horizontal plane. You're going to hear those used fairly interchangeably, but the transverse, axial, or horizontal plane cuts the body into a superior and inferior piece. And we see something like this. This cut is going through and catching the lungs, little tiny bit of the liver right there, and then the heart right here. So this is probably would be slicing this fellow right about there. So we're looking at a cut that has divided the person into superior and inferior pieces, and this allows us to see certain structures at certain times. There's the vertebral body, spinal cord. Great stuff. And that is the end of the self-study module. You'll have a quick assessment on this during orientation week, and I hope it was enlightening. Looking forward to meeting you all, and have a great day.